There's no easy way out of type 2 diabetes, but for Dan, it didn't take an 800-calorie diet. And the fear is that some may struggle to tread the line between what's healthy and what goes too far. Ali Fortescue, Sky News.
Well, we can talk now to Dr. Aseem Malhotra, who's in Manchester for us. He's an NHS consultant cardiologist. Do you think this is a good idea?
Sophie, I think we have to put this in context. Type 2 diabetes now is the biggest threat, if you like, to the NHS. It's the biggest public health crisis of our time. It's taking up 10% of the NHS budget. It's a condition that has so many complications associated. So whatever we can do to help patients should be welcomed. But I think what we need to talk about really is the elephant in the room. This is a condition really which is an intolerance to starchy carbohydrates, to carbohydrates. And actually, there's an alternative way to this low-calorie drink, which is just eating real food, which cuts out bread, pasta, potatoes, sugar. You know, this sort of dietary plan can actually help people with this condition, if not just in a similar way to what you've already demonstrated with low-calorie liquid shake, but actually, in my view, in a better way. There's some very good data from the United States, from Virta Health, that showed that 60% of participants involved in a real food, not calorie counting, ketogenic or very low carbohydrate diet were able to reverse their type 2 diabetes within a year. So what I would say is, of course, this is an option, but every patient I've spoken to, Sophie, and I've managed lots of these patients, as you probably know, Deputy Leader of the Labour Party, Tom Watson, actually reversed his type 2 diabetes and lost a significant amount of weight in a year from eating real food. Even yesterday in your program, they discussed boxer Tyson Fury and how he had gone on a low carbohydrate diet to lose 10 stone. So I think let's give patients those options. I'm also concerned about the fact that we use this calorie-focused thinking to manage this condition. I mean, about a third of people with type 2 diabetes also have a normal body mass index and normal weight. We won't be asking them to lose a drastic amount of weight to improve their health. Actually, changing diet can improve blood glucose and get people off medication. So I'm a bit concerned that we're not discussing actually there's an alternative that, in my experience, patients would prefer.
At the same time, though, a lot of these people who have been put on what sounds like a pretty drastic diet to me may have tried to eat healthily before. They may have tried to bring their diabetes under control before and struggled. At least this is a very simple, direct way of trying to manage it that might work for some people.
So, Sophie, I think you've got a very good point there, and I agree. I think when people have tried other ways through diet and it hasn't worked and they're really struggling, then let's have this as another option, of course. But actually, you talk about this healthy diet. If you ask those people, a lot of those people would have followed the traditional, let me cut the fat out, let me reduce the amount of portion size that I'm eating, as opposed to actually just doing an approach which doesn't involve calorie counting. In fact, what I tell my patients is, as long as you cut the starch and sugar, you can eat till you're full, stop snacking, and let your body tell you when you're hungry. It's actually that simple. And when people actually follow this, I mean, I've seen patients who've reversed their type 2 diabetes, Sophie, within a month. Within a month, they've been diagnosed with type 2 diabetes for 10, 15 years. They've come off medications. It works. It can work quite quickly. So we should at least offer them that option. And if we don't do that, it's actually unethical. I'm somebody that practices evidence-based medicine, and part of that concept of evidence-based medicine means using your clinical expertise or experience, the best available evidence, and we've got other evidence of benefit from other approaches from food, and then take into consideration patients' values and preferences. And the reality is, of course, some people may choose this, but if we don't do that, we're actually, doing them a disservice in the NHS.
Thank you very much, Dr. Aseem Malhotra there, giving his views on those strict calorie shakes.